Yali Mudad, everyone, and welcome to another episode of the Healthy Bytes podcast. We're delighted to be joined today by one of my fellow health board members, Dr. Jameel Karim, who is an emergency medicine consultant. Thank you very much, Jameel, for taking the time to join us today.
I'm very, very glad to be here.
Jameel, as a frontline NHS worker in the current health climate, what has it been for you and your colleagues?
It's been a challenging time, understandably. For the patients, it's been scary. They've had little to no contact with their loved ones or their close friends and family. It's also a new disease, and there's a lot of uncertainty amongst the public about what's going to happen to them. It's also very unusual for them because they're having to be treated by staff who are wearing masks and gloves and gowns. For families, it's been very difficult. They've had limited contact with their loved ones, and they're having to communicate difficult and sometimes emotional conversations over the phone. For staff, it's been tiring. We've been working in difficult and tiring conditions, and people are feeling emotionally drained. But it's also been difficult because the information that we've had has been changing on a daily basis about how to treat patients.
Absolutely. And Jameel, tell me, if an individual were to present to A&E with symptoms suggestive of the coronavirus, such as a fever or a new cough, can you talk us through the initial journey?
So when they come to the emergency department, they are asked to book in at reception. They'll be given a mask. They will be triaged by a nurse very shortly afterwards. And they will be sent to an area where they'll be seen either by a nurse or a doctor. That nurse or doctor will then ask further questions about their symptoms, such as how long they've had symptoms for, and trying to get more of an idea of how well or unwell they've been. Followed after that conversation will be an examination, and they may well have blood tests. They may well have an X-ray of their chest and a tracing of their heart as well. All those things put together gives us useful information to try and determine whether patients need to stay in hospital or can be discharged, and if they are going to stay, what treatments they may need.
Thank you, that's really clear. And if a Jamaati member were to develop symptoms suggestive of coronavirus, at what point should they seek medical attention?
I think it's important to say that for 85% of the Jamaat, the infection will be mild or even with no real symptoms. And that's certainly a very reassuring thing about this illness. Where I think they need to seek help is if they are having prolonged or ongoing temperatures, if they're feeling breathless, either on exertion or especially at rest, if they feel unwell, and if they have chronic conditions such as heart disease or lung disease, or they are above 70 years old with the symptoms I've just mentioned.
Okay, thank you for clarifying. What a lot of the medical community have noticed is that there's been a noticeable decline in presentations relating to non-COVID symptoms. I'm sure there's a lot of anxiety within the Jamaat in presenting to hospital in the current climate. What would your advice be to Jamaati members who may want to seek medical attention for non-coronavirus symptoms?
And you're entirely right, Hafiz, that we have, certainly in my department, we've seen less of our usual workload. So we haven't seen as many heart attacks, strokes, infections or injuries. Some of that is because, for example, people are going out less, they're undertaking less recreational activities and therefore not injuring themselves. In other instances, they are being seen directly in other sort of community environments or directly by specialists. The easiest way for members of the Jamaat to get advice and help they need is to either speak to their GP or call 111.
Absolutely. And finally, I just wanted to end on a question relating to maintaining morale within your teams. So, as an A&E consultant, you are the frontline staff. How have yourself and your team managed during this health crisis?
Firstly, we've tried to support each other, and that seemed like a very obvious thing to say, but hospitals are not naturally or normally the most supportive environments. Departments have supported each other, firstly and foremost, and then amongst those departments, members of staff have ensured that each other are coping, but that we're lending supportive and sympathetic ears to each other. Most of us have tried to pay attention to ensure that we're getting enough sleep, that we are managing regular exercise, that we're eating a balanced diet. And I think crucially, and probably certainly for me, most importantly, is to stay in contact with friends and family. And that's to ensure that we're getting the support, advice from our friends and family. And that can be very important from a psychological aspect. I do want to say that my colleagues and I have been absolutely astonished by the messages of appreciation and support from the Jamaat and the country as a whole. I've certainly never known anything like it, and it's been wonderfully joyous and uplifting, particularly working in these difficult environments.
Absolutely. And on that positive note, I want to thank Jameel for taking the time to joining us in this podcast. And if members of the Jamaat have any questions relating to coronavirus, do contact us via the helpline. The number will be on the screen. And until our next episode, stay safe, stay healthy, and Yali Madad.